Well, good morning. Like so many, the last few months have been cause for reflection, not just on those momentous events that have occurred, but on those moments in our city, in our state, and our nation that may inform our path forward during these tumultuous times. Thankfully, our city's 200-year history reveals Indianapolis having a consistent record of firm resolution in the face of adversity. In the mid-1800s, our city leaders came together to install running water and provide a lifeline to a burgeoning state capital on the verge of a public health crisis. In 1936, as our nation's Great Depression in the midst of and a historic heat wave at the same time gripping our city, people donated so that the hardest hit in our community could receive much needed refrigeration for food through a penny ice fund formed by the Salvation Army and the Indianapolis Star. Across two world wars, Indianapolis families embraced the challenge of wartime rationing, even when that meant lean tables and the throttling back of an automobile industry that was becoming part of our city's character. And perhaps most relevant to today's discussion, when Indianapolis was confronted with a pandemic flu in 1918, residents and businesses rallied to embrace medical best practices, leading to a citywide shutdown and eventually the imposition of a requirement that residents wear masks when in public. The result of those efforts? According to one academic analysis, Indianapolis had a death rate of just 0.3%, which was among the lowest in the entire country. Over time and across centuries, where others may have wavered, Indianapolis has consistently risen as one city to meet challenges head on. This morning, we find ourselves at a familiar crossroad. I'll state the obvious. Though many metrics have stabilized in our city, this pandemic has not gone away. And across the country, we are seeing unfortunate reminders of what can occur when a city or a state lets their guard down and allows COVID-19 to spread unabated. To that end, in just a few moments, as I always do, I will turn things over to Dr. Virginia Caine, my partner and the head of the Marion County Public Health Department. And she will discuss changes to our local public health orders that will take effect next Thursday, July the 9th. On that date, Marion County will, for the most part, be adopting what Governor Holcomb announced yesterday as stage 4.5 of Indiana's Back on Track plan. That means that bars, movie theaters, cultural and entertainment venues will remain at 50% capacity. It means that restaurants will remain at 75% capacity. Most outdoor activities will be permissible, but we must continue to exercise extreme caution indoors, where research has consistently shown that we face the greatest risk. There are a few differences, though, between our local health order and the state's phase 4.5 that I'd like to take a moment to highlight. Indoor areas of assisted living and nursing home facilities will remain closed to visitors in Marion County. Overnight camps will remain closed in Marion County. And while events, conventions, fairs, festivals, and sporting events may be permitted to operate with many at reduced capacity, we are now requiring that any event anticipating attendance over 1,000 people submit a public health event plan and receive approval from the Marion County Public Health Department. I also would note that this morning, with yesterday's announcement that the state will continue restrictions on indoor restaurant and bar capacity, we are signing executive orders that will extend temporary street closures on Broad Ripple Avenue, Mass Avenue, and Georgia Street through Sunday, July 19th. It is our hope that over those 2 weeks, we can continue to engage with affected business owners as we chart a course toward a longer-term sustainable solution for these key commercial corridors. And finally, and perhaps most importantly, effective July 9th, the Marion County Public Health Department will be requiring face coverings for residents when they are out in public. There is a growing consensus that wearing face coverings and practicing smart social distancing will be the key to allowing our city to continue edging forward in the weeks and months ahead. Similar to the mandates instituted in other Indiana counties and other cities, such as Nashville and Jacksonville, this face covering requirement will apply in 2 major categories. First, if you are out of your home in an indoor space, masks will be required. While masks may be removed if you are alone in your office, like I am as we speak, or if you're eating at your table in a restaurant, they should be worn at all other times when you are indoors with other people. This includes office buildings and retail establishments of all types. Secondly, masks are required if you are outdoors and unable to socially distance. This means you may not have to wear a mask if you're taking a run or walking with your immediate family in a park. But if you're sitting in the stands at a Little League game or standing in line at a Dairy Queen, you should be wearing a face covering. This new public health order excludes children aged 2 and under, and it excludes anyone with a medical condition that prevents the use of a mask. Now, I know that many will not agree with this policy. I know many more will feel inconvenienced by it. This is a major change to what normal means here in Indianapolis. And I sympathize with those who feel overwhelmed by the transformation of our daily lives. But I'll be honest, I don't have sympathy for those who may argue in the coming days that this simple, science-driven policy is an unjust burden. We've lost 125,000 Americans to this disease already. That's more than the death toll our nation faced in the entirety of World War I. That includes thousands of Hoosiers and hundreds of our neighbors right here in Marion County. And tens of thousands more will die across our country in the weeks and months to come. Every piece of scientific evidence that we have indicates that wearing a face covering in compliance with this public health order will protect those around you, and full compliance will mean you protect yourself as well. This isn't complicated. It's a piece of cloth. It's a piece of cloth that could save your life and the lives of those around you. And it is the right thing to do. And that means if you are willfully choosing to not follow this order, You are dead wrong in the fullest sense of that expression. This weekend, we celebrate those who did the difficult things to preserve personal freedom. We don't celebrate those who whined about it. But I don't want to dwell on those people because they aren't the main characters in the story that we together are writing. They are a distraction from the powerful message we will send in the coming weeks and months. A moment that I know will join the ranks of those times in our city's 200-year history where Indianapolis proved itself up to the task, no matter how daunting. That's why I want to conclude my remarks by once again thanking the residents of Marion County and the city of Indianapolis for their patience and for their cooperation during this difficult time. This is not easy. I know. But I also know that by coming together as one city, by wearing a face covering when you leave your home, we are doing our part to defeat COVID-19 and ensure the fastest return to normalcy that we can have given this enormous global pandemic. So, Indianapolis, keep doing your part. Encourage your friends and your family to wear face coverings in public. Practice social distancing when you go out to the store. Protect older relatives and neighbors by running errands for them. There are still hundreds of ways we can show what community means in Indianapolis during this time. We are in this together, and we will emerge stronger on the other side. So now, with more information, I'll hand things over to Dr. Virginia Caine, Director of the Marion County Public Health Department. Dr. Caine.
Thank you, Mayor. You know, the last few months have been difficult for our city, and we have all made sacrifices. And it's because of these sacrifices that our numbers have improved and we avoided a crisis in our hospitals. But the COVID-19 pandemic is far from over. And this challenge will require more from all of us if we are to overcome it. That's why today we are mandating that masks be worn in all indoor public spaces, as well as any outdoor spaces where you are unable to social distance. It will take all of us to keep our city healthy. Wear your mask for your neighbors, for your friends, for your family, and wear your mask for the city of Indianapolis. Now, I'll provide an update on the latest data for Marion County. We now have 11,387 cases in Marion County with 679 deaths. Next slide. And if we look at our new COVID-19 cases, as you can see, we've had a significant decline in our cases since April the 8th. We had a slight bump at our peak the last week in April, first week in May. But since then, we have had a steady decline in our COVID-19 cases. Next slide. When we look at the emergency room department visits with patients who have COVID-19 symptoms, you've also seen a significant decline in our emergency visits. Next slide. Our hospital missions have dramatically been reduced for persons with COVID-19. And of course, we have seen a dramatic decrease in the number of deaths that have occurred as a result of this COVID-19 epidemic. And one of the major interventions needed to address this COVID-19 is our ability to get the people who are high risk being able to get tested for COVID-19. And as we have seen, we have steadily increased the number of COVID-19 tests that are occurring daily. Next slide. And of a percent of individuals who are positive, we've also seen a dramatic decline since our peak of cases in the last week of April, where the number of people who are remaining positive for COVID-19 tests have been dramatically reduced. And one interesting trend, though, that I think that we have noticed over the course of the last 2 months, that we have seen a shift in the age distribution of COVID-19 cases, where we went from 65% of our cases under the age of 60 at the start of the epidemic, the first month of the epidemic. We are now seeing that has dramatically increased to 86%. So you can see in our category of our 20 to 39-year-olds, at least 50% of all of our COVID cases are under the age of 40. Under the age of 40, over 50% of our cases. So we are seeing a younger age population now contracting this COVID-19 cases. Next slide. Of other special note that I think that we have to keep our attention on is that when we look at our surrounding states surrounding Indiana, practically almost every state is seeing a significant increase in their number of COVID-19 cases. Illinois, in a 2-week period, went from 641 cases to 773 cases occurring a day. Ohio has gone from 407 cases up to almost doubling their number of cases in a 2-week period for the number of cases in one day. And we've even seen a 33% increase in cases from the state of Kentucky. So we have to understand that we're just a plane ride away or car travel for the state of Indiana, and as well as Indianapolis as a large metropolitan city, that we have to be conscious of this and have an abundance of caution in our recommendations to account and address for what's happening surrounding us. Next slide. So it's slightly a busy slide, but you can see where the new cases are increasing. So those cases that are in the dark red, so Michigan, Ohio, West Virginia are seeing a significant increase, over 100% increase in their cases compared to 2 weeks ago. And as you can see, Indiana remains almost nearly the same with a slight bump. But in the Midwest, the state of Indiana and Indianapolis are doing much better and improved compared to their surrounding counterparts. And so Marion County's public health order, the city tracks the state's order, but for masks are now required in all public places. Youth overnight camps are not open. Religious services must maintain social distancing guidelines. Risk mitigation plan approval for all conferences, fairs, festivals, and venues that have more than 100 people are required. And our K-12 school plan recommendations are forthcoming and will be on our website later today. And so I want to thank you, Mayor, and the rest of the staff and all of our expert panel members. Thank you from the Fairbanks School of Public Health and our epidemiology department and your staff for helping us progress and have made a substantial success in terms of going in the right direction for our COVID-19 cases. So thank you again, Mayor, for your leadership in this regard.
At this time, we will begin doing Q&A. As always, if you'll put your name and outlet into the Q&A box, we will call upon you and unmute you to begin your conversation with the mayor and Dr. Caine. First up, we have Russ McQuaid from Fox 59.
And good morning, Mr. Mayor.
Russ?
How do we see enforcement of a face covering guideline or orders? Social pressure will convince people to do the right thing, or I can envision a situation where a customer goes into a store, a clerk says you can't come in here without a face mask, puts hands on him, and then that technically is a battery case. So how are we going to encourage or enforce that?
Doctor, you want to
let me just answer that for you. So, Russ, I think the primary response we have for people who are not compliant and are not wearing their mask, it has to be education. It's got to be our primary focus. That's got to be huge. And we have to have a campaign to really emphasize the value and importance of wearing their mask. But, as always, you will still have individuals who are concerned about their civil and independent rights that will not want to comply. And for those individuals, we will be looking to find, whether it's an individual or a business, provide fines for them in order to help address compliance.
Eric Berman, WIBC.
Good morning, Mayor.
Hey, Eric, you have a lot of feedback. We're having a hard time hearing you.
Yeah, I think I fixed it. No, I have not. All right, now we've got it fixed, I think. Better now? Great.
Yep.
Two questions, sort of partly a follow-up on Russ's question and then a related one. Is the amount of any fines already set through existing health code or ordinances? And if not, how do we set that? And a related point in terms of enforcement. We've all seen the viral videos of people hounding people who aren't wearing masks. There's been some people, other way around, there's some people hounding people who aren't wearing them. There's been a lot of massive people hounding people who are. Elkhart County's ordinance includes a requirement that people not harass others. Is there anything like that contemplated in the Indianapolis version?
We're looking at that ordinance very carefully in terms of we don't want to put anybody, of course, in danger related to the mask. And so we do have to be very careful. We've seen situations like that, I believe, out of the state of Michigan. But if we're going to see large groups of gatherings of people and a significant number of them are not wearing masks, we will have to intervene. And we appreciate if they see incidents like that to contact the health department and let us be aware of that issue.
Adam Wren, Indy Monthly.
Yes, Mr. Mayor.
Yeah, Adam.
If mask wearing is essential, why wait a week to adopt this? And also, Governor Holcomb yesterday said that he believed in Hoosiers to do the right thing and didn't think a mandate was necessary. Do you have a different view of the case?
Well, let me answer your first question. We are waiting a week on the requirement that people who go out in public have a face covering, because obviously, as Dr. Caine has indicated, it is a time for public education and public awareness that this requirement will be implemented on the date that we intend to do so. Frankly, Adam, it also allows for businesses and venues that will be affected to prepare themselves. So we wanted to give time for not only a public education for individuals in Marion County, but also for our businesses and other venues. As it relates to, the governor's comment yesterday, it's really not an issue of trust. I have tremendous trust and faith in the people of the city of Indianapolis, and I know the governor has trust in the people of Indiana. We are simply taking this step in no small measure because, as we have said time and time again, Indianapolis and Marion County have been affected disproportionately over and against other areas of the state. Even though the population of Marion County may be anywhere from 12 to 13% of the population of the state of Indiana, as Dr. Caine's statistics underscore, while we're making progress, we still have a disproportionately high number of both presumptive positive cases as well as COVID-related deaths. And so we just simply believe that the face coverings are yet another effort to better protect. We still need to social distance. We still need to practice good hygiene with hand washing and hand sanitizers. But I don't believe that wearing a face covering in public when social distancing is not capable of being maintained. I don't see that as a burden. I see this as just another step in helping Indianapolis return to a greater sense of normalcy than we have experienced over the last 2 to 3 months.
Ross Dodge, WITT.
Good morning.
Hi, Ross.
Hi. A couple of things. First off, you mentioned that people could report through the health department violations. Will there be a specific form there? And then also, in light of this expansion of wearing masks, will there be an expansion of the free mask program?
Well, I'll defer to Dr. Caine on the form question. Let me take your second question though first, and this actually is alongside I think Adam, who previously asked about why we are waiting a week on face coverings. One thing I didn't mention was the fact that we want to make sure that there is a sufficient time for everyone to obtain a mask. Many have already. I see people wearing masks all the time. They've taken advantage of the programs that we as a county have provided for face coverings. But we do need to make sure that the requirement to wear a face covering, that they have the face covering, and a week's time will hopefully allow us to make sure that everyone who needs a mask gets it. As it relates to the specific form, I'll defer to Dr. Caine on that.
Yes, so initially we're going to have complaints go to the EOC manager for indy.gov. For the initial complaints and forms will be available for you guys to review.
And then, Mayor and Dr. Caine, I just want to add, I'd say a month and a half ago, the city, in combination with the health department, as well as other agencies, created a task force to review and oversee the capacity issues when it came to restaurants and bars. And so we'll continue to work with and utilize that forum when it comes to mask wearing. But as Dr. Caine and the mayor said, this is really first an education platform. And as we announced last week, we have Mask Up Indy, and we still encourage people to go to the city's website to be able to order and get a mask sent to their house or their community organization.
As a reminder, that is indy.gov/masks. Up next is Tom Healy with Midtown Magazine.
Morning, Mayor, Dr. Caine. Dr. Caine, this is for you. Your colleague, Brittany Yarnell, sent out a situation report on the 29th of June that indicated that African Americans or blacks account for 22% of the cases in Marion County and 35% of the deaths. In previous press conferences, we talked about the social determinants of health, and I'm wondering with this masking initiative and the outreach that you're doing, how you're going to reach these highly affected communities. What are your strategies for that?
So we've had a number of strategies, and not only an increase in the African American community, but also an increase in our Latinx population is that this huge initiative right now of providing a million masks through the city of Indianapolis is really key. And we're trying to use venues where we see a predominant number of African Americans utilizing those services or partaking of those activities related to that. For example, we gave 1,200 masks to our seniors and disability individuals just last weekend, of which I would say probably 90% of those individuals were African American. The week before, we gave almost 1,000 masks out to a homeless population from all of the shelters, and of which a significant percentage of our homeless population are African Americans. And then the week just before that, we had an initiative with over 20 Latin organizations in our community, where we distributed in the four corners of the city of Indianapolis over 5,000 masks distributed to our Latin population. We provided masks for the Mexican consulate. And so we're continuing to have additional activities where we're really trying to reach our different racial and ethnic populations.
Sherry Rudetsky, Indy Star.
Hi, I've been contacted by a reader, and I will confess that I'm not familiar with the open carry laws of our state, but this reader is concerned that wearing a mask conflicts with the open carry laws of the state, which, according to him, prohibit you from wearing a mask if you're carrying a gun. Has anyone looked at that issue?
Yeah, I'd have to defer to our city council, corporation council in that regard.
So the short answer is that I haven't examined that issue in great detail, and I'm not sure whether the health department lawyers have either. But as with any issue, right, sort of the state law always governs over the local order. So certainly if that is a problem, that's something that the state will address, and obviously we are bound by state law, and of course we'll follow it.
And our last question is from David Williams at Wish TV.
Good morning, everyone, and good morning, Mayor. Question for you and Dr. Caine. We have heard of quarantine parties in Alabama, and that's apparently where young people are gathering at parties at people's houses and seeing who can contract the COVID-19 coronavirus first, and whoever does apparently wins a pot of money. Have you heard of anything like this happening in our city or county or central Indiana?
So thank God I have not heard of anything happening in the state of Indiana. And that was so frightening when I heard about this and read about this, because, you know, you could be pronouncing a life-threatening sentence to another individual related to the carelessness and thoughtlessness of doing these type of activities. And it's just so very, very frightening that that activity took place in Alabama, and hopefully no one across the country would repeat that episode, because I think it puts that person at risk when they're deliberately trying to infect someone and there's some morbidity or even mortality. It puts that whole individual from a liability standpoint some very negative consequences. And so I would hope no one in their right mind would follow that example. Especially, I think we're too smart. Our students are too smart for that in the state of Indiana, city of Indianapolis. Students, you hear me now. You hear what I'm saying about you. You're too smart for something of that nature happening in the city of Indianapolis and the state of Indiana.
Thank you all so much for joining us. A flyer, a press release, and a link to this press conference will be distributed following the event. Thank you.